Good afternoon, everyone. This is Hussein Hachem for WhatsApp Media Network, and today we're live with Dr. Glenn Maleyko, superintendent of Dearborn Public Schools, discussing the latest updates regarding the school reopening plan, mask mandates, social distancing, the live feed decision, live camera feed from the schools to Dearborn Police, explaining that part, talking about any contingency plans in terms of if needed to close and if that's going to happen. Also discussing the cleaning effort and all of the questions that we got from you guys. As soon as we announced the show yesterday, we received tons of questions from you guys, and I really want to thank everyone that reached out and send us their concern and questions so we can discuss them with Dr. Glenn Maleyko today. I don't want to take a lot of time. This show is live. Anyone that would like to basically ask any question, they can write it in the comment box. Whether you're watching us on Facebook or YouTube, please join the conversation and engage with us. And we will try to include as many questions as possible from you guys. We have a limited time, so in case we don't ask a specific question, my apologies from now. Dr. Maleyko, welcome to the show.
Thank you, Mr. Hashim. Appreciate being here as always. I know I've been on the show before, and you do a great job in the community informing the public. Thank you for having me.
Thank you for your time. We have a lot of ground to cover, so I'm going to start right away with you. I just want to make sure, people, this is live, Facebook, YouTube, even our website. You're able to put your question in the comment box. I see some of you already are writing their questions, and I'm going to show some of the questions like that. Like you see, that's an example for the questions that we're going to show on the screen. So this is your time. This is your chance if you want to have a direct communication with Dr. Maleyko here. The other thing, please feel free to share the show so more and more people are able to tune in and ask their questions. And even after this interview is done, the link will be, the show will still be available on our Facebook and YouTube page and also on our website. Dr. Maleyko, you guys had an intense meeting on Monday when you guys revealed your school reopening plan, and part of the plan was a mask mandate. I want to start with the school reopening plan that you guys agreed on, or the school board voted on. What does the school reopening plan entails?
So there are really two things, is that we are no longer under last year's rules, which the state allowed for a hybrid, virtual, and or other options. And you might recall that for most of the year we were virtual and then we went to hybrid.
Yes.
The state law that expired in June, so we're no longer under that provision. We no longer have to have a vote at every board meeting. Right now, basically, you're back in school full time is the option. So there's no other option other than you can apply for what we call a virtual school. We did that early on. Not all districts have done that. This is under the law pre-COVID as well. So we applied for the school way back in early May. We were approved in June, or actually, I think it was even April. We were approved in May. We started enrollment, and we allowed parents that wanted to choose the virtual school to enroll. We have about over 500 students in that school.
Oh,
so it's a lot less than it was last year, but it did give that opportunity. So basically, our plan is that we're back for in-person instruction. I would always advocate that in-person instruction is best, and we're getting. We're excited to welcome students back on Monday the 30th for a half day on August 30th.
So if anyone want to join the virtual option, that's not available right now. I guess it's closed, right?
The enrollment was closed, but I'm just mentioning it because it was part of our plan, our return to school plan, and that
Sure.
did get. Now we do have a limited availability through a boundary line exemption option, but we gave out multiple notifications to parents that, hey, we understand you're in the pandemic. We cannot move massive numbers of students, this close to the school year. And so,
Yes.
Moving a lot of students is not possible. So applications are not available right now. It's closed.
Okay.
We do have a limited process that people can use if they have a hardship, but we're doing that on a very limited basis because we just don't have the staff to focus and shift.
Okay, so that's available, but it's on very limited basis. Okay, very good.
It was fully open. If people would have met the deadline in June, we would have accommodated as many, but the deadline closed. And so now, because our staffing has been put in place, there's very few additional spots available.
Okay, very good. Okay, we'll go back then to the, go ahead, Dr. Maleyko, to the reopening plan.
So yeah, so that's basically the plan. But I mean, really, I think you're talking about the mitigation that we discussed
Yes.
with the board, and we did present a PowerPoint. Our mitigation plan is multi-layered.
Okay.
We're looking at social distancing, where possible, 3 feet. We are not going to be able to do the 6 feet. In large areas and large gatherings, we're going to do 6 feet, so we're not going to have maximum capacity when indoors. At elementary, we have lower class size, so we have a greater ability to have students, maintain distance. But to be honest, the reality is we have large schools with large students, so secondary is going to be very difficult, but we'll still have the arrows. We'll have massive cleaning arrangements. In fact, I'm going to send you a YouTube video. We're still going to be sanitizing and doing all the things we did last year. We're not going to change those routines within our approach. We also are advocating for vaccines. We have between 75 to 80% of their staff vaccinated. We may have more. We're starting to collect some additional data on that. We're advocating for all students that are eligible to get the vaccine. And we ran several vaccine clinics last year for students and staff.
And we did a video about that, me and you, last year when you guys done it.
We're going to partner with the county health department too, with the staff once boosters are available, because some of the teachers were vaccinated soon under the 1B category from the governor. And so we, under the order way back in January. So we're going to do that once they're eligible. We also have masks. Yes, we do have masks as part of our mandate. We are mandating it.
Okay, before we move to the mask mandate, Dr. Maleyko, because I want to spend some time on the mask mandate as possible. In terms of the social distancing, so just I can close that part. Some parents, they reached out to us. They said, what's going to be the student count? Is it going to be regularly? It's going to be 28, 31. I know it depends on the school level, if it's elementary, middle school, or high school. But are we using pre-pandemic number, or especially that you said you guys are going to try to do at least the 3 feet social distancing part?
Yeah, I mean, the only way we can accommodate all our students is to go back to our normal class size. Having said that, we've invested in additional teachers, though, during the pandemic. And our class size at elementary is the average is around 21 students. It's a very good. And so some classes are lower. We're overstaffed right now. We were able to use some of the federal funding. I would also say, too, that we've upgraded. Another part of our mitigation is upgrading our HVAC systems, and we're doing that. And we're looking at using some of that funding for air conditioning and or upgraded systems in buildings for air filtration. But yes, it will be back to, and we did put that out back in June, that we're going back to, there's no other provision for it, because you can't have last year, if you recall, we did hybrid, so you could bring half the students each a day, and that's how you limit it. We don't have that luxury under the current state law.
Okay. The other part that was asked is basically, and I know we're waiting for Dave to send us a video. You guys prepared the video for students and their parents to see how you guys are going to be doing your cleaning effort. But as a general idea, what's the plan in terms of making sure everything is sanitized?
Yeah, I mean, it's the same as last year. If you recall, we talked about all the same thing, cleaning throughout the building, doing the restrooms. Here, I'm going to paste the link into the video. I just received it. I think this video gives a good option of some of the protocol. We purchased additional cleaners and things. There are regulations on hazard materials that we follow, but Mark Andrews and his team did a great job. And then we actually go in this video, we go into school and show you these devices that we have that we can go around and sanitize the desktops and things of that nature. They kind of look like a Ghostbuster machine, if you recall that movie Ghostbusters, where they're pumping. And so if you look on the video, you'll see, that example. I think one of the engineers, Ali, shows you how he does that. But generally, I mean, we have additional cleaning protocols and additional sanitizing. We have, lots of PPE in storage and ready to distribute to the schools. And it is in the schools to provide, a safe environment for our students.
So that's the video. I mean, we're not going to be able to play the whole 7 minutes, but just so you guys know what Dr. Maleyko is talking about, that's the video. You guys can go to it. It's on the district's website. And I'm going to put that for anyone that asks about the cleaning part, how they're going to be able to do the cleaning part. The website is also, I put it for you guys in the comment section.
Absolutely nothing toxic, nothing that can harm me or harm myself.
Nothing at all.
Fantastic.
Very good. So this is the video. You guys will be able to watch it. The link is in the comment section on Facebook and YouTube. So please feel free to do so. The other part that we received a question about is the ventilation. Some of those buildings we have in Dearborn Public Schools are old. Was anything done through the federal money that you guys got to basically address that issue?
Yeah, so some of the federal money came in, some of it has not yet come in. So we have 2 HVAC specialists that we hired a couple of years ago, and it was a great move that we did. This was actually pre-pandemic, we hired them. And so they've been analyzing every single building in the district for proper ventilation, and they're looking at any rooms that may, so they go around and test, and they're providing their expertise. So we're not using the federal funding for their positions. We're funding it out of our general fund, but there is federal money available that you can use for HVAC. So we're looking at a significant portion in the next phase that's coming from the federal government to do upgrades. Now, it will take some time. It does not mean that we would have air conditioning in every single room in the district, as that's a huge expense, but we will start to phase in air conditioning, and especially filtration, and the exchange of inside and outside air is an important aspect. In fact, opening windows is an important aspect, and just getting that fans and exchange of air, but also having a good HVAC system. So we are definitely have invested in it, and we're in the process of investing more into those systems.
Awesome. Let me get to the mask mandate that was revealed on Monday, and I watched the meeting, and some parents were furious about that decision. Walk us through it, Dr. Maleyko. How was this decision made? Which recommendations did you guys base that decision on? And what does it entitles?
So a month and a half ago, 2 months ago, everything looked really positive with the COVID. We had vaccines coming up. We had very low rates. In fact, for the first 5 weeks, we had an 8-week summer program, over 8,400 students. The largest in the state. We compensated staff well, and the students were very excited, and so were the staff. It was great in the buildings when I went in there. Now, just from the summer program, the first 5 weeks, we had no cases. All of a sudden, the last few weeks, we started to get some cases, which was matching the data in the community. The positivity rate started to go up. It was very low back in June and early July, and then it was on the rise. So we're looking at data in the community. We're looking at vaccine rates. I talked to Dr. Hamami, who worked for Wayne County Health Department. Students that are eligible, he's saying that they're only 35 to 40% in the county are vaccinated. So we need to get that up. We also need to get the number up on overall, we're below 65%. As mentioned, we're about 80% of staff, so that's a positive. So that's why we need to promote the vaccines, and Pfizer now has full approval from the FDA for no longer emergency. So we're looking at vaccine rates, we're looking at community spread, we were looking at hospitalizations, and then we were looking at the CDC guidance and recommendations, which changed several times. And then it changed from the Michigan Department of Health and Human Services in Wayne County. And they came out with a lot more. They basically said schools should mandate masks in school. That's what they came out and stated. So they weren't saying that in July. So we were following their guidelines in July. Then we looked at our own data, and we believe it's the responsible thing to do. I wear my mask. Here's the thing. We want to keep students in school, okay? So if this is going to help keep people safe, not only to prevent the spread, but there's a practical reason under the quarantine rules. If students are in school, and let's just use elementary, who we know are not eligible to get vaccinated, that's the other factor that comes into play. So if students all have the mask on in a classroom, let's say it's a second grade class, for example, but it could be applicable anywhere, and they all have their mask on, and then someone gets the virus, let's say, they have to report it. Then we do contact tracing with the county, the Wayne County Health Department. If they all have the mask on, and the students that were within their 6-foot social distance area, if they all had masks on, then only the person that got the positive test would have to quarantine.
Oh, okay.
The others will not have to quarantine if they all had a mask on. They must all have it on. So the person, if one student within that group does not have the mask within that area, then they're all quarantining for 10 days. Now, obviously, if they had symptoms and other things, then they have to quarantine and we'd send them for testing. But if they don't have symptoms because they wore the mask, and that was happening last year when a lot of school districts, not per se in ours, but in other school districts where they had full capacity, they were having students, they'd have to send them home for 10 days. And it happened once to some students. So there's a practical reason for the masks too, for staff and students. For staff, it's the same thing. If they have the mask on, now we're going to be reasonable with staff, teachers standing, and I mentioned this on Monday night, teachers standing at the front of the room, they're teaching, and the students are back a little bit. The teacher can take the mask off to speak to the students, but as the teacher approaches that 6-foot radius, they got to put the mask on. Just like I'm in my office now, I don't have anyone near me, I can take it off. So that's something we're going to be reasonable with that. And
so if a teacher is sitting at her desk or standing at the board explaining stuff, as long as she's 6 feet away from the student, she doesn't have, or he doesn't have to basically wear a mask.
Well, I would say they still have to have it with them because they're going to move around the room. But during that time that they're speaking, as long as the students are back a little bit, we want the students to be able to hear and see the lip movement of the teacher and allow that teacher to speak. So again, they have to be cautious, but we are allowing for that, delineation. And we know that sometimes, someone might have to pull it down for a second here and there to breathe, or we are recommending it, but we're not requiring it outside too. So that's another factor. Last year it was still required for recess and other things under the state rules. And then athletics is not required. We follow the MHSAA guidelines for athletics.
So let me take it one by one, because what you're saying, is not what some people were talking about it on social media. And that's why we did the Show Me and You, so we can explain the facts for people to know exactly what's going on. So the first thing you said, we're recommending it, we're not requiring it. What do you mean by that?
Well, that's for outside.
For outside.
So
okay.
I'm not going to call it optional. I'm just going to say that we're not doing a requirement outside. It is
so outside.
100% required inside the building. So
inside the building, 100%.
100% for everybody.
Okay. Recess and outside, no.
Recess and outside, if someone takes it off, it's fine.
Okay. Are kids gonna be going to what's it called, to take lunch breaks to the cafeteria?
Yes.
So the cafeteria is gonna be open.
Correct.
Are they gonna be social distancing in the cafeteria?
We cannot guarantee a 6 foot. We will do seating charts for contact tracing, but there will not be there. We'll do our best, but we can't guarantee it.
Okay, but they have to wear their mask in the cafeteria?
They have to wear their mask, and the rules are for staff and students, when they sit down to eat, they can take the mask off.
Okay, so perfect. Okay. Is there any exemptions?
There are medical exemptions. The only exemption would be if someone provides proper medical diagnosis from a physician, they would submit it to the school. The school would have the nurses review it.
So it has to be submitted to the school, and the nurses have to give the okay on it?
Correct.
Okay. So let's say, because many people reached out to me saying, my daughter has asthma, or my son has breathing issues, and when they put the mask on, they start wheezing, or they cannot breathe. So they have to get a paper from the doctor stating that they cannot wear a mask for you guys to consider giving them an exemptions, right?
Yeah, they need a medical diagnosis from a certified physician that's fully licensed, explaining the reason why they cannot wear the mask.
Okay.
And that information will be kept confidential. We wouldn't share it with anyone, but they would have to provide that if they want us to look at allowing them not to wear a mask. We did not have very many students last year that took us up on that offer. So
okay, Faye is asking, what's going to happen if someone refuses to wear it? What's their punishment?
So I don't look at things as punishment. I would ask that the community steps up, and the parents, and says, there's a greater thing going on here, and this is where we need the help of the parents. We need to, we had students all last year that wore it. Everyone was used to it. We come into the stores now, and I know the state relieved the order, and to me, it was odd taking it off. I still wear it when I go into Target or Panera or wherever it may be, especially with the rates going up. So we need kind of the parents to step up and help us with that, to help promote the fact that we need the students to wear it. So we will work with the students. and we will encourage them. And we have we have a whole stockpile of masks. We'll hand them out if needed. Obviously, then we have our normal protocols. We don't want staff and teachers to be mask police. We want people to understand there's a greater need here to do it. We'll contact parents and we'll follow our protocols. Just as somebody was not complying with another rule in the school, we'd give them opportunity to change, but ultimately it is a school rule. So, breaking the rule, there is consequences.
So it's not like the teacher is going to be sitting there and let's say a mask is down, because especially with elementary students, they're not, able to basically every time, make sure it's above the nose, it's there, you know what I mean? Are they going to be lenient with that?
We have to be reasonable, right? So, but we also know that people can educate themselves or the parents can educate students on the proper way to wear a mask. I can even do it. We do it in a video. Look, it should be above the nose. And we can have a teacher that encourage if it comes down a little. We understand things are going to happen. I don't like wearing the mask either, but I'm doing it because it's the right thing to do. And so that's why we just make that decision. Okay. When someone's like you might see at the board meeting, we're allowed to take it off when we speak, but then we put it back on, and we have so we're kind of leading by example. We want all our staff to do that as well. We're hoping we don't have a lot of enforcement. And I know there's different groups out there that with different viewpoints, but this really should not be a political decision. It should be we're not making it political. This is just about protecting kids, the community. And so for us, this is the right thing to do given the data. Now we will revisit it. So we're not saying that this is indefinite for the whole year. It could be, but we're going to look at the data. So if the community steps up and gets more of the vaccines, then we could look at lowering that rule. I can also tell you that certain counties like Oakland County have mandated it countywide, so districts don't even have an opportunity. Superintendents have asked county and state health departments to step in, and they're the epidemiologists, they're the experts. We've asked them to step in and make the decisions. I can tell you too, I've had very positive communications with Commissioner Beydoun and others, and Davita Colbert from Wayne County RISA is really advocating for a mandate as well. Her and the superintendents across the state, and we put out statements from our associations have said, basically that we need their support as well, because they're the experts in the health areas. We're the expert in educational implementation for our students.
Okay. I know we had a question from FIDA. What about the buses, Dr. Maleyko?
Buses are 100% required. It's a federal rule.
Okay. It is a federal rule, by the way, for the buses. It's a mask mandate for buses and trains and all that kind of stuff.
And
airplanes. You said the athletic programs and the sport programs, it's not required for them, right?
We're going to follow that. So if students are competing, it's not going to be required during competition or practice.
How about people who attend to basically watch the games?
So right now we are saying it's highly recommended, but we're not mandating it because that's the MHSAA rule. We are currently reviewing that and we'll continue to revisit it. But right now we strongly and highly recommend that visitors wear the masks. But right now it's subject to change. It could change, but right now, unless the state could come out with a new rule from the MDHS and MHSAA, which is the organization that is the governing body for athletics for high schools.
Okay. Are there going to be any social distancing on buses?
It is not possible on buses.
Okay.
That's why masks are mandated.
Okay.
Now, if we have buses lower numbers, then we're going to social distance. But in order to provide that service, we don't have the ability. So that's why the masks are critical.
Okay. Are we? I know during athletics and sports last year, you guys required weekly testing. If I'm not wrong, is that taken out too?
There's no requirement on testing. We will continue to advocate that athletes get the vaccine. Okay.
As you know, New York announced yesterday that they're doing vaccine mandates for teachers. New York City yesterday. Is there any plan to mandate vaccines either for staff or students?
So there's no mandate at this point in time. Pfizer, as I mentioned, is now full approval. I believe there will be more conversations that will occur. And, like I said, we're 80% of our staff, so we're ahead. I believe we may even be higher than that when it comes down to it. So we think we're in good shape right now. We're not planning yet, but those conversations will likely occur. Students is a little more complicated than staff. We may need, the state to step in and make some decisions there. And obviously we have to consult with our legal counsel.
I mean, because students already, you guys mandate some of the immunization already, right?
And that's based on state law. So we need the state to step in and create those.
So for the teachers, the conversation will happen. For the students, you guys have to wait for state law.
Well, I would say the conversation will probably happen on all, but we're not yet committed to any mandates yet. I will say this, staff, and we sent this out, all staff under the MIOSHA rules, which is the governing body over workmen rules in the state, requires that you do a daily check sheet if you are not fully vaccinated. So we've started to collect vaccine cards from staff who do not want to sign in daily to the check sheet card for the screening. And so that is something that we're starting to do with our staff. We also have a good number. We know a lot of the staff that were vaccinated because we coordinated it for them way back in February and March.
Okay. Sharifa, we did understand the question and we asked the question. We ask you that to be respectful in the comment section, please. Dr. Maleyko, I want to move to the part. I know, last year things where you guys had to open, then you guys closed for a certain period. Is there any contingency plans? And is there any discussion about when will you guys be forced to close your door again and go to virtual? Will that happen again this year?
I mean, I hope not. And that's why we're advocating for the vaccines. If there were they're now calling a cluster, but if there was an outbreak in a school, the health department will be talking to us and we'll be working with them on recommendations. We have, under state law, I mean, I have the ability, we're under attendance requirements of 75% in the district. And then we also only have like 6 days we can use for emergency closures. So I have that ability. So we'll monitor. I don't think we're close to that, but if it does come to that point, we have that ability. I would think that the county and the state would be stepping in if the rates get really bad. I am hearing, of other states, thankfully not Michigan right now, which is, again, why I'm going to say everyone should get vaccinated because we want to combat this. So, I mean, if we have to shut down for an extended period of time, the state would have to step in because we don't have the legal authority to do that. When the pandemic started back in March of 2020, the state stepped in and they had to authorize, and then they passed legislation. The Michigan Department of Health and Human Services does have the ability to order us into virtual if they felt the need. But I don't anticipate that, and I hope it doesn't happen. We are fully ready with our online learning module, though, if necessary. Okay.
As you know, always when there is something that happens in schools, always the special education or special ed student are the most hit students. How are you guys planning to support this student population, the special ed students?
Well, all special education students, and Mr. Staley spoke to this on Monday. He's our head of our special populations in the district, our executive director. They all have an individualized education plan. And so we know that in-person instruction is best for all students. And that's why last year we also had extended learning lab time for those students 5 days a week when general education did not get 5 days a week when we were doing the learning labs. So we understand that, and it's not just going to be Dearborn. This is across the nation of special populations that are going to need additional support. And I appreciate the parents and I understand their struggles. And that's why we need to, I'm going to keep saying it, we need to get vaccinated, follow our mitigation because we want to keep the students in schools because we know that we have specialized teachers that are providing that support depending on the disability of the students. Parents have the rights within the IEP to have, input and direction as to what services will be provided under state law. And our team in special ed does a great job, especially last year under some difficult circumstances, with that.
Any attention will be paid to social and emotional support?
Absolutely. In fact, we discussed that as well. We're on a district-wide training for all teachers and staff on trauma-informed instruction. In fact, they're doing it just today, by the way. Teachers are in the buildings today. They're getting training. Mr. Asaley and his team and Ms. Bazzy Gates and others are leading the charge in that area. And we've also hired additional social workers in the district. We have additional counselors at the secondary level. And so that's a huge aspect that we need to look at. The state superintendent, Dr. Rice, has asked all districts to really focus on that. And so has the federal U.S. Department of Education.
How are you guys planning to use the federal money you guys got, the COVID-19 federal money?
So we're looking at 4 different areas generally. One of them was, one of the areas was the summer school program. So we invested a huge amount in extra summer school, and we're looking at summer school and extended day learning. That's one area. So that provides additional support to get students caught up. And that's why we had that large program, because we knew students needed it. We really invested in it. We want to look at it as well. For future programs and for after school programs as well. We're looking at HVAC, as I mentioned. Then we're looking at staffing to support students. We want that to happen as well. And we're going to look at additional interventions along with, we're looking at the possibility of expansion at the Henry Ford College. You might recall that we have the early college program. We have dual enrollment, and we have the Collegiate Academy. Mr. Fadullah heads that up. In fact, we're presenting at the county regarding that. And so we're looking at, we've saved in the millions of dollars to parents that have enrolled in those programs, because they can get college credit. They can also get a associate's degree along with a high school diploma from graduating from those programs. We're the largest in the state, and we're going to continue to try to expand, and we're in negotiations with the college for expansion.
Okay, as you know, Dr. Maleyko, I know you guys had the summer program. You guys were trying to use that program to basically, address any learning loss that happened, and it did happen last year. But not 100% of the students were attending those programs. Any plans to address learning loss during school year?
Yeah, absolutely. That's why we have an intervention staff, and we would do that on a normal basis. We're very pleased that we had 8,400 students take advantage of that summer program. We're going to look at extended learning opportunities, not only after school, but during the day as well. And we're planning to fund those programs. We probably have we're one of the leading districts when it comes to professional development and interventionists and coordinators at the literacy, mathematics level, and others. And a lot of districts look to us for those areas because of the leadership we've had over many years, prior to me being superintendent as well, but we've really ramped it up. We got Ms. Fatmi Faraj, Dr. Chokol. We've got intervention specialists in the curriculum area with Ms. Rose Al-Dubaili, who's the current interim executive director, and she works with the ELL students. And then obviously Mr. Asaley's staff for special ed, providing those additional supports.
Okay, I have Samara or Sam asking, did special education funding decrease during COVID? Then why did services? Last year, there was no plan to reach the students, and children went without servicing for months. What's your specific plan to reach these kids should the state shut down?
Should the state shut down? So I'm not aware of any reductions. We were under rules, though, where we couldn't, students were home virtually for much of the year under the state rules. Our team was in direct contact with the county to ensure that we were following all special ed protocol and rules as far as providing student support. We also purchased some electronic software to help for servicing kids that were at home. That's why, again, I'm going to go back to, nobody wanted to do what we did last year, to be honest. I didn't want to do that, and special ed students were probably those students that I thought of the most as far as needing to be in the school. So that happened not just in Dearborn, but across the state. We were in compliance, and we provided the extra support as needed, because we understand, it was very challenging for parents that, students may have social, emotional, or mental, but they have physical disabilities that needed support as well. And we weren't able to provide the same kind of support. we know in the medical profession, a lot of it went virtual too with, what do they call those, televisits and things like that. And so we purchased software to allow that. So my plan is that we do not want to, send, and that's why we need to advocate for masks, advocate for vaccines, and let's keep it where our staff are able to provide the in-person instruction. And if not, we are ready. If it has to happen again, which we hope it doesn't, we're ready to provide virtual support for students.
Janan, we answered that question. Do kids have to get vaccinated? Just for anyone that's tuning in right now, this interview will be available wherever you're watching it, whether you're watching it on Facebook or YouTube. You can rewatch the whole thing at your own time during any time you want. This will stay on our Facebook page, on our YouTube page, and also you can go to our website, www.whatsappmedianetwork.com, and be able to also watch the whole interview again. Okay. I didn't notice we have some questions from YouTube, but I'll go back to that. The last point I want to address, Dr. Maleyko, it's basically the decision to allow Dearborn Police to have live camera feed from common areas from the schools. There was some confusion about that part too. People were talking about privacy. They were talking about students funneling those students to prisons. I need you to give us the facts on that part. When are they? Go ahead.
There's a lot of misinformation on that, and that's where you got to be careful with what you hear on social media. We presented it before the board. If you want to go back and watch the tape of the June 7th or the June 21st board meeting on YouTube, on our website, the facts are presented there. We also discussed it on July 26th.
So June 7 and June
21 and July 26th.
Okay.
And just to let the public know, we're very public about it. We started this conversation several years ago. Now we're in COVID, so that's the overarching safety concern. But you may remember, Mr. Hachem, back in 2018, we had the Parkland shooting in Florida. Students in Dearborn protested about guns and things. We didn't advocate for anything. They came out at all the high schools and they had a protest. And so it was on the minds of everyone, safety. We presented at those board meetings about the amount of gun violence that's been occurring. The motivation for this is to protect students. The police do not have the time of day. They will not be sitting all day watching. Right now, we have cameras in the building. We do plan to expand it. And you might remember from the bond, we were planning to expand. But that's not because we want the police in there. We already have the ability to do that for our staff. Our staff controls the video camera systems in our district, and we do use it to protect students and staff. And
so we currently do have cameras, just so for people to know. Schools already do have cameras in place. And actually, they do have security systems. And some of the schools, they have double doors to protect those students. And part of the programs or the things that the bond was trying to fix is having more security cameras and more double door security at the other schools that doesn't have it. Go ahead, Dr. Maleyko.
Yeah, and that's the biggest thing pre-pandemic that we heard from parents is they want to keep their kids safe from the issues that were happening across the nation. And so their technology is available. And so what we started to do, again, we were going to cameras for our own purpose. We can use them anyway for our own purpose. It's public areas that the school district controls. The police don't have that. But what we did with the police is in an emergency, let's say there was an active shooter, and I hope it's the biggest nightmare a superintendent would ever have is an active shooter situation. But I also don't want to say that I had the technology to be able to have the police to look in the buildings and to protect and potentially save the life of a child. If this saves the life of one child, it's worth it. In Parkland and other places we presented on this, the police did not have eyes in the building. It took them a while to isolate the intruders, and having access to that will protect staff and students from potential disaster. Now, we hope we never, ever have to use it. Another situation could be if we have a medical situation and the EMS is called, and the ability to have the switchboard, or I'm not saying the right terminology there, but at the call-in center, when you'd call 911, the ability to go in and help guide the staff or students. We had a situation a couple of years ago, just before the pandemic, where we had a medical emergency for a student, and the teacher performed CPR and they used the AED machine. That saved the life of that child. In fact, we had the police and the first responders come to the board meeting, and we dedicated that AED every October. So those kind of situations are, saving the life of a student. That's what we're looking at, or a staff member. It is not something that anyone's going to be monitoring. They will only use when, with permission through us, and it is only to protect in the case of an emergency. We also have to do other things. So that's when you're in a situation. We also have to do things too with our students in our community, to continue to work with the police as far as, preventative measures as well. And so that's the reason for this. We don't have cameras in the classroom too, by the way. I want to mention that.
This is what I wanted to ask. This is what the part I wanted to ask. Where do you guys have those cameras? Is it in the library, the cafeteria, the hallways? Where do you guys have them?
Yeah, the general areas. I mean, it might be the cafeteria. It's the entry points of the building for security reasons. We have them like pointed on the football fields. They're in common areas, but they're not in the classrooms.
No classroom.
Now, they're not in the classrooms, no. And in fact, if we were to consider them in the classrooms, we're going to bring it back before the board. But have no consideration as I'm superintendent. The only reason I say that is because you never know with technology that may change in the future. There are many other districts that already have this technology. Okay, so we're not the first district to do this. Oakland County, I know several, even in Wayne County. Mm-hmm. So, I mean, we would not want to be in a situation where we had this technology to save the life of a child and we didn't do it. We need to.
And it's going to be used in the active situation, active shooter situation, and medical emergency. And the other point and the other point I would really want to highlight that you mentioned is basically they have to take the permission from the schools before they access it, right?
Well, they will only access it in emergency, but we have a system to track anybody that accesses it, so we control it. But we don't want them to have to call me to get permission during an emergency. So they have permission, but we audit it on a regular basis. It's in the agreement where we will know who accesses it, and only the people at the call. It's not called the call-in center. I'm trying to remember what they call it. Dispatch center. It's only the only people that can access it are those that are trained in using it, and they will have specific accounts so we would know who. But I'm going to tell you, they're not going to be monitoring things. Again, cameras in the schools. We use the video personally for our own purposes. We have video cameras on every bus. It helps us to protect students as well, and we do use them. But we don't give it to the police or anything. We use it for our own purposes. This isn't an emergency.
So the police is not allowed to have to basically monitor 24/7.
Correct. That the agreement is that they wouldn't be monitored, and they don't have the personnel to do that. That would be a huge cost, to be honest.
Okay, and then you guys have the ability to see who's basically having access to the cameras.
Correct. And we give them permission of the individuals that are trained. And then every time, if there was an emergency, let's say a 911 was called because something happened at school A, whichever school it may be, there'd be a documentation that goes to our IT department under what we call Active Directory, where they would know who would log in. They just like if I log into my account at work, they have a documentation of that.
Okay. Very good. Is there anything you want to add about the live feed cameras?
No, I mean, this is just really about saving, this is me. I recommended this. I'll be honest. It's been talked about for several years, and why, as superintendent, I need to protect our students. And that's what I'm doing. And that's why I strongly recommended it. And that's why I'm excited that the board approved it again. I hope we never have to use it, but I do not want to be in a situation where we say we had technology that could have saved a life and we didn't do it. And that's where we're at with this situation.
Okay, Dr. Maleyko, anything? I know you sent a welcome letter. I want to share that welcome letter if you want to comment on it.
Yeah, just welcoming back parents. I mean, we're very excited. There's going to be a video I'm going to put out soon too. We're excited. Students are coming back. You're going to see me in the schools. Yes, I do like to go around and interact with students. Students like getting the pictures and they, like getting in the Instagram and that. And that's just really done to be a positive thing of interaction, and I'm glad the students know who I am and can reach out. And the students actually recommended to me years ago on my advisory councils to do the Instagram and to do the pictures with the sign and the selfies. And they told me on the videos, we did the 1 minute message that came from the students. They told me that that's what you should do. So that's what I've done. We're going to continue to work with them in our group. And so we understand that parents are going to be excited, and so are students. I explained it today. You know, a lot of times I was an elementary administrator and an elementary teacher. And I know that for parents that are sending their child, the first and the oldest, to kindergarten, and Mr. Hachem, you could probably relate to some of the, you know, there's excitement, but there's also some worrisome. And I remember my daughter's in college now. But I remember my wife when, you know, when she was going into kindergarten, and it was a tough thing. And there's excitement, but there was also, you know, you're kind of nervous for the year 2 and what's going to happen. What I would say under COVID is, you know, maybe it's not all kindergartners, but we know that a lot of students and parents have those same excitement and reservations because of COVID across the board, K-12. And that's why I will use that analogy. And so we have to be understanding of those. And we want to thank the students, you know, for that, you know, for their support and understanding and working with us. So, you know, we welcome you back, and I'm excited, and I appreciate you having me here, Mr. Hachem, and the work you do with your group to inform the community.
I want to thank you again, Dr. Maleyko, for this accessibility and transparency with the community. You're always one phone call away whenever we ask you to join us and you know, open that direct channel of communication with the community. You're always willing to do so, and I know you're always touring those buildings and talking to students and talking to parents, and you're very accessible, and people can always reach you either through social media or through your offices. So thank you again. We appreciate this partnership between Dearborn Public Schools and WhatsApp Media Network to have that channel of communication with the parents and with the community. Thank you again, Dr. Maleyko, and best of luck on a successful and healthy school year.
Well, I really appreciate that. And if I can just add too, look, we're all in this together. We want to get beyond this pandemic, and we got to, even there's differing viewpoints. I get it. But the best thing is if we're united and we help each other out. And that's what I want to do. I want to help everyone. And I hope we get the support, and I appreciate your help, because we're a team in this, really, if you think about it. That's the only way we're going to get beyond this. And that's what we need to do, despite the differing viewpoints out there. Differing viewpoints are healthy as long as we do it in a proper decorum and in a responsible manner. So thank you so much.
Definitely. Thank you again, Dr. Maleyko. Thank you, everyone, for tuning in. This was Hussein Hashim for WhatsApp Media Network. This interview will be available on our Facebook, YouTube page, and website. You will be able to watch it at any point you want. We talked about the school reopening plan, the mask mandate, the social distancing, and the student count, social and emotional support, the live camera feed from the schools to Dearborn Police, the plans to help the special education students. We talked about the athletics and sport programs, about if any discussions are going on for vaccine mandates, and also about the cleaning effort. All of that stuff, we talked about it during this interview, live interview with Dr. Glenn Maleyko from the Dearborn Public Schools. Again, feel free to share it. Feel free to send it to families and friends. You can always watch us on Facebook, YouTube, TikTok, Instagram, and Twitter. Like and follow the page for the latest update. Until next time, this was Hussein Hashim for WhatsApp Media Network. Thank you, and goodbye.